Yeah, morning everyone. So before the slides start. So in this short talk, I would like to pronounce to Karthikeyan sir and Dr. Newton sir and all the distinguished guests here and all the panelists also. It's a short presentation, though I have prepared some of the contextual slides and all. Today morning, when I listened to the great personalities, so most of the content is already covered in that. That is how I felt. Practically, whatever I did in the last 25 years of my spiritual tablet research, those two slides I would like to elaborate a bit more, and rest of the slides just will try to have a glance. So I am very happy to participate in this conference. Last year also I was here, and really by bringing the true change in the policymakers, that is how really we can scale up the whole progress we are trying to do in a spiritual health arena. It's not moving. First one. Can I use this? So here we have to understand the global is continuously going. So in this, in spite of spending more, we are not properly reaching the true health from the medical perspective. So dependency on the modern medicine is increased in a great way. These are all the topics today morning we heard from Nagendra sir and all the distinguished guests. And coming to the global health burden, 9 to 10 trillions of annual spending is going towards of the health, and 10% of global GDP is completely devoted towards the health area. In spite of spending high money, and the outcome is very poor from the simple satisfaction to the total health. So the gap in the current system, the physical health is prioritized, and mental and spiritual health is completely ignored, and the preventive approaches are completely lacking in the current system. So finally, the fragmented system is applied. So the whole research work in the last 25 years is based on the principle, spiritual intellect is the root and physical health is the fruit. So when we work on the spiritual intellect, by improving the wisdom, understanding ourselves not just by our body, by our consciousness and energy and wisdom units, we can bring a complete health on the physical plane. So here we are trying to give the spiritual solutions where with the meditation as a primary tool, which starts giving the energy and then the peace of mind and the calmness, and through which the positive thinking will be improved, which boosts the immunity, and the group energy practices like the programs that we are doing will automatically enhance the group consciousness, and then nature living also will give a complete leaf. So here to look into the research lens, the hormonal studies, there are a lot of research papers where the positive hormones as well as the stress hormones were completely come into balance when we apply meditation on regular basis. And studies by Louis Hay and Deepak Chopra, so many eminent spiritual scientists, they gave their own techniques and thoughts through wisdom, through which one can achieve a greater health and happiness. So these are some of the miraculous case studies which made me to walk in this path as a full-timer. The initial 10 years of practice completely blend into a pure spiritual training. So a case with myasthenia gravis, a complete neuromuscular disorder. Initially he was into 80 mg steroids, and after starting medication on the deathbed itself, every 2 hours, 4 hours, 6 hours he did intense meditation, and over a period of time the drug were completely toppled. And today it's been 12 years with a zero medication, and he is living peacefully across the globe. He is traveling. So a neuromuscular problem patient completely recovering from steroids is like a medical miracle, I can say. And the other case, hemophilia, is from the rural area background. Today, this patient is receiving 10,000 rupees per month from the government for his hemophilia illness, because the government is spending money for all the chronic illnesses where they are supposed to go for regular medication treatment. But with intense meditation sessions and ashram dharma and regular counselings, he was completely recovered. He is not taking any medication, but he is using that money as a monthly amount for him to teach medication in the rural areas. So from the foundation also we are supporting, and he is working as a full-time meditation teacher, working as a spiritual doctor in the rural area, especially targeting the exceptional illnesses. And then she is a teacher. She got scoliosis affected the spine problem, and with that she admitted in my rural medical hospital almost like 12 years ago. 1 month she was there in the hospital. Doctors told because of that spinal correction is not happening, so soon she may die. From that point, she started working on her, and it was completely, even though the bend is still there, the pain part and the suffering was completely gone. And 2 years ago, voluntarily she took retirement, and now she is working as an in charge for the whole Tamil Nadu to teach meditation as a meditation teacher. So all these are like 1 in 10,000 or 1 in 1 lakh cases. When I worked with these illnesses over a period of time, with intense meditations, they got cured, and that really changed their complete perspective in life. So these are the grassroots level. When we say most of the illnesses are cured, especially the chronic illnesses and 1 in 10 lakh illnesses, there's a lot of work is going on behind the screens. The intense meditation practices, we admit them in rural hospitals where they stay for 40 days. Number of times they do the 40 days workout with intense meditations beneath the pyramid in the nature and in the friendly atmosphere with the master's guidance. And with that holistic lifestyle integration changes also will be done, and they will understand the oneness principles, and slowly they will come to understand the purpose of life, the true purposeful meaning. Today morning the Saraswati teacher, she is saying clearly, even though a lot of abundance is there, the real thing is missing. So that whatever that real thing that is missing, they will understand when they go through that journey of understanding the life. And finally, they land in the spiritual service. So in these changing trends, the whole world has to come into oneness. So apart from our self-sadhana, realizing ourselves, each and every individual has got their own community dharma. So that is what meditation and all the spiritual service, that itself becomes as a group practice to realize ourselves and to gain whatever is required. So these are some recommendations during the panel discussion time I would like to exhibit. So in this presentation, the main stress point is, when we say the meditation and the spiritual practices that gives a complete health and it reduces the global burden, there must be a proper setup, like how much amount of the meditation practices they are supposed to undergo, and how much amount of the realization, the book reading and the guidance. Once everything is fit in place, then definitely we can achieve a complete health. That's why the people are simply thinking that meditation means it is only a simple stress reliever or a simple, minor agonist only will go away. But most of the tumors and autoimmune disorders we are working, miraculously we are getting result by working a proper quantity of practices that are involved in day-to-day life. Thank you. Thank you very much all.